7 checkups seniors over 70 should refuse to risky, not helpful. If you're over 70, this could be the most important video you watch this year. Because while most health advice urges seniors to stay on top of screenings and tests, there's a growing wave of concern in the medical community. Some common checkups may actually do more harm than good. They lead to unnecessary treatments, dangerous side effects, and even permanent complications, all under the false promise of early detection. In this video, we're exposing 7 medical checkups that many seniors are being pushed to take even when science says they may not help anymore. We'll break down what these tests are, why they were once considered helpful, and why the risks now outweigh the benefits for older adults. You'll hear real stories, recent studies, and practical advice to protect yourself not just from disease, but from overtreatment. And make no mistake, this isn't about ignoring your health. It's about protecting it the smart way. Number 1. Routine PSA tests for prostate cancer. For men over 70, routine PSA prostate-specific antigen tests are still commonly offered during checkups. On the surface, it sounds responsible, a simple blood test that might catch prostate cancer early. But here's the problem. Many of the cancers found in older men grow so slowly they'd never cause harm during the person's lifetime. Yet once a high PSA level is flagged, it often leads to biopsies, radiation, hormone therapy, or even surgery, each of which comes with serious risks. A 2017 study published in JAMA showed that the harms of PSA screening in older men, including infection, incontinence, and impotence, far outweighed the benefits. The U.S. Preventive Services Task Force now advises against routine PSA screening for men over 70 because it can lead to what's known as overdiagnosis, treating cancers that would never become life-threatening. But despite this warning, many clinics still offer the test without discussing the risks. Consider what happened to 74-year-old Harold from Indiana. His PSA levels were slightly elevated, so his doctor recommended a biopsy. The result? A very low-risk tumor, but Harold, feeling scared, chose to undergo radiation therapy. Months later, he was left with chronic fatigue, bladder problems, and regret. As he put it, "I wish someone had told me it wasn't necessary." This story is more common than you think. In fact, many seniors end up suffering not from the disease, but from the aggressive treatments that followed a single test result. And in most cases, especially over 70, watchful waiting would have been safer. Number 2. Annual full-body CT scans. Without symptoms, many seniors are offered full-body CT scans as part of advanced screenings or so-called preventive packages, often at private clinics or through health marketing promotions. The idea sounds appealing. Scan everything, find hidden problems before they cause damage. But what these offers don't explain is that full-body CT scans expose you to a high dose of radiation, up to 500 times more than a standard chest X-ray. And for older adults, this exposure carries significant risks, including an increased chance of developing cancer over time. Worse yet, these scans often reveal harmless anomalies, tiny nodules, cysts, or calcifications that trigger unnecessary anxiety. More scans, biopsies, or even surgeries. A landmark review in the New England Journal of Medicine warned against the routine use of full-body CT scans in asymptomatic individuals, especially seniors, citing both the radiation risk and the high false positive rate. 72-year-old Clara from Arizona underwent one of these scans during a wellness event at her local hospital. The scan found a small spot on her liver. It turned out to be benign, but only after 4 months of tests, travel, stress, and a painful needle biopsy that left her with complications. She told her daughter afterward, "I went in healthy and came out exhausted, both physically and emotionally." This kind of story is becoming alarmingly common. CT scans are powerful tools, but without symptoms or medical indication. They're like using a sledgehammer to look for a whisper. At a certain age, less is more when it comes to radiation testing. Number 3. Bone density scans too frequently after 70. Bone density tests, or DXA scans, are important for diagnosing osteoporosis. But once you reach 70, repeating this scan every year or even every 2 years may be unnecessary and even misleading. Studies show that bone density changes so slowly in older adults that frequent testing rarely influences treatment decisions, according to research published in the Archives of Internal Medicine for seniors with normal or mildly low bone density. It takes up to 15 years on average to progress to a level that would require intervention. Yet many older adults are pressured into yearly scans, especially women. Often pushed by clinics or even pharmaceutical-sponsored programs, these frequent tests can lead to overprescription of medications like bisphosphonates, which carry serious side effects, including jaw decay, esophageal irritation, and atypical fractures. 76-year-old Betty from Florida had been taking osteoporosis medication for nearly a decade. Despite only minor changes in her scans, eventually she developed osteonecrosis of the jaw, a rare but devastating side effect linked to the drug. Her doctors admitted later, "You probably never needed the treatment to begin with." Overtesting creates a false sense of urgency and nudges patients into long-term drug use that might do more harm than good. For most seniors, without new risk factors or fractures, bone density scans should be spaced much further apart and in some cases stopped altogether. Number 4. Colonoscopies after age 75. Without symptoms, colonoscopies are a critical tool in cancer prevention. But after age 75, especially if you've had clean results in the past, the risks of the procedure can outweigh the benefits. The American Cancer Society and the U.S. Preventive Services Task Force both recommend stopping routine colorectal cancer screenings at age 75 for most adults, unless there are new symptoms or specific risk factors. Why? Because colonoscopy is an invasive test that requires sedation, bowel prep, and carries risks such as perforation, bleeding, dehydration, and adverse reactions to anesthesia, all of which become more dangerous as we age. A comprehensive study in the Annals of Internal Medicine found that complications from colonoscopies in patients over 75 were twice as likely compared to those in younger age groups. Yet many seniors are still routinely scheduled for this procedure without anyone questioning if it's still necessary. 79-year-old Frank from Oregon underwent a routine colonoscopy just because it was due. During the procedure, his colon was perforated, leading to emergency surgery and a 6-week hospital stay. The most heartbreaking part: his previous colonoscopy had been perfectly clean, and there was no family history of colon cancer. Doctors later agreed that the test was not essential. This kind of oversight stems from a one-size-fits-all screening mentality that ignores age and individual risk. After 75, most colonoscopies should only be done based on symptoms, not a calendar reminder. Number 5. Routine cardiac stress tests without symptoms. For seniors over 70, especially those without a history of heart disease or current symptoms like chest pain or shortness of breath, routine cardiac stress tests, whether it's on a treadmill or with imaging like nuclear scans, are often more harmful than helpful. These tests are sometimes ordered as part of annual heart health evaluations or required before unrelated surgeries, even if there's no medical reason. But studies have consistently shown that in low-risk seniors, routine stress testing leads to a cascade of unnecessary follow-ups. More invasive tests like cardiac catheterization, exposure to radiation, and in some cases, procedures like stent placement, even when no real benefit exists. A major 2020 review in the Journal of the American College of Cardiology confirmed that stress testing in asymptomatic seniors did not improve survival or outcomes, but significantly increased the chance of false positives and overtreatment. Imagine you're 73 feeling fine, going for a routine checkup, and suddenly you're told your stress test looked abnormal. That's exactly what happened to Leonard, a retired teacher from Pennsylvania. He went from a stress test to a cardiac angiogram in less than a week. A small blockage was found, but not dangerous enough to warrant surgery. Still, a stent was placed just to be safe, and within a month, Leonard developed a serious infection at the catheter site. He spent weeks recovering, all from a chain of interventions triggered by a test that probably shouldn't have happened. These tests are often marketed as proactive, but for asymptomatic seniors, they're more like a trapdoor into the healthcare maze. Unless you have real symptoms or a strong family history, routine stress tests after 70 may offer little insight and major risk. Number 6. frequent abdominal ultrasounds to check on organs. Without symptoms, abdominal ultrasounds are often offered to seniors as part of routine physicals or so-called preventive scans. Marketed as a harmless way to check on the liver, kidneys, pancreas, and other internal organs. And while ultrasounds are indeed non-invasive and radiation-free, their overuse in people over 70 without any symptoms can create more problems than they solve. These scans frequently detect what radiologists call incidentalomas, small, harmless anomalies that show up on imaging but have no clinical importance. These might be cysts, benign growths, slight enlargements, or age-related changes that would never cause harm. But once spotted, they're hard to ignore. Doctors often recommend follow-up scans, biopsies, or even surgery just to rule things out, even when there's no danger. A study in the British Medical Journal highlighted how incidental findings from abdominal scans often lead to a spiral of unnecessary interventions in seniors, increasing anxiety and healthcare costs without improving outcomes. Take the story of Marlene, 75, from Wisconsin. Her doctor recommended an abdominal ultrasound just to be safe during her annual checkup. The scan showed a small cyst on her pancreas. Panicked, she was sent for a CT scan, then an endoscopic biopsy. The result, benign, but the procedure triggered pancreatitis, leaving her in the hospital for 5 days. She later said, "If I hadn't agreed to that first scan, I would have never gone through any of it, and I was feeling fine to begin with." Unfortunately, Marlene's experience is not rare for seniors without pain, digestive issues, or unexplained weight loss. Frequent abdominal ultrasounds can quickly lead to what experts now call the diagnostic snowball, a cascade of tests chasing shadows. And each step brings new risks: infection, sedation, complications, false positives, and emotional distress. Just because a tool is non-invasive doesn't mean it's harmless. When there are no symptoms, sometimes not scanning is the safest choice of all. Number 7. Cognitive screening tests without clear purpose or follow-up plan. Cognitive decline is a real and frightening concern for many. People over 70 and with Alzheimer's and dementia on the rise, it's understandable that both doctors and families want to catch it early. But here's what most seniors aren't told. Routine cognitive screening tests, like the Mini Mental State Exam MMSE or the Montreal Cognitive Assessment MoCA, can lead to stigma, anxiety, misdiagnosis, and in some cases even loss of autonomy when used in the wrong context. These brief quizzes, often done during annual wellness visits, are not designed to diagnose dementia. They simply measure patterns that might warrant further investigation. But when used improperly or without a clear follow-up plan, they can do real harm. A false positive result might label someone as cognitively impaired, even if their performance was influenced by fatigue, hearing loss, language barriers, or nervousness. And once that label is in your chart, it can follow you, affecting insurance, decision-making rights, and how medical professionals treat you in future emergencies. According to a 2022 review published in The Lancet Healthy Longevity, over 30% of seniors flagged by cognitive screening tests did not have dementia, but were nonetheless subjected to repeat testing, neurologist referrals, and even inappropriate prescriptions. Consider what happened to Joan, age 78, from Colorado. She was sharp, independent, and still driving. During a checkup, her doctor casually ran a memory test and marked her as mild cognitive impairment because she struggled with a few word recalls. That single label triggered a recommendation to stop driving, which her family acted on. Within a month, she lost access to her volunteer work, her independence, and even friends who began speaking to her differently. No follow-up scan was done. No neurologist confirmed anything. Years later, Joan still lives without any cognitive decline, but her confidence was shattered by a checklist she didn't know she was taking. Stories like this show why context matters. If you or your loved one are experiencing noticeable memory issues, testing might help. But when screening is done out of routine or curiosity, it can cause more psychological and social harm than the condition it claims to detect. And without clear guidance, emotional support, and a plan for next steps, these tests leave seniors in limbo, uncertain about what the results really mean. In many cases, awareness of one's own changes is already the best indicator, and respecting that insight is often more helpful than a surprise score on a cold checklist. So, what's the real takeaway from all this? It's not, don't get checked. It's, get checked for the right reasons at the right time and with full information. As we get older, our bodies change, but so should our approach to medicine. Blindly repeating tests, just because it's what we've always done, can lead to more fear, more procedures, and more harm. At Senior Book, we believe in smarter health, not more health care. We believe in protecting your independence, your dignity, and your peace of mind. So before you agree to another test, ask, why this test? What will it change? And is it really necessary or just routine? Share this video with a loved one over 70, and let's start a real conversation about how to age with wisdom, not just medical appointments. Your health is your story. Let's help you write it well.